Hey, friends. It's good to be back in the studio with you again. Today, we're starting a new series, the most important series or group of videos that I've ever done. And it's most important because this is something that needs to be settled. This series is called Vaccines, Truth over Tribe. And why did I start this? Why did I start this series? Because if anybody is trying to get to the truth about vaccines and they get on the internet and they look up anything regarding vaccines, almost all, and I mean close to 99% of the information is going to be strongly biased from one side or the other. It is very, very difficult to get truth, and truth is what we need when it comes to making decisions about vaccines. Vaccines are something that can be life and death situations. And so instead of doing things that could potentially put our children or grandchildren at risk, we need to get to the bottom of this and put all of the tribalism and all of the agendas aside and get to the bottom of this so that we can make educated, informed decisions. It's very important that we have the freedom to make these decisions on behalf of ourselves and our families. But the most important thing when we make those decisions is that we're making the decisions with the proper information. If we're getting information that's wrong because we're only taking information from one side or the other, then we're not doing our family a service, or our patients in the case of physicians. If we never met before, I'm Dr. Joe Kraft, and I'm an emergency department physician with over 30 years of experience. But I originally started in adult internal medicine and pediatrics. That's what I originally got boarded in. And I've worked in pediatric ERs and general emergency departments since then. In the ER, we really don't deal with vaccines that much. Maybe the flu vaccine or a COVID vaccine or a tetanus shot or something like that. But we don't get involved with recommending vaccines to people. We do, unfortunately, deal with unvaccinated issues. I just had a pertussis this last week, and we see people that are dealing with vaccine issues or vaccine-related issues all the time. And so whenever these kind of issues come up and when family ask me what my perspective is, I get online just like everybody else and I look up the pros and cons, and the more I read, the more I realize I'm not getting good information. So the purpose of this study and this video series is to take you along with me on an investigative journey, so to speak, where we actually look at the information that's out there. We take the time to really look at the studies. We get past all of the misinformation that's out there on both sides of the aisle. And we finally get to the end of this series with some good recommendations and guidance for making decisions for ourselves and our families. If that's something that's interesting to you, that you think it would be good to get to know what's true about vaccines, then come along with me on this journey. Now, this is just the first video. It's an introduction. It's to tell you I'm committing to get to the bottom of this. Each video from this point on is going to have a lot more specific information. Unfortunately, each video isn't going to be talking about the whole broad spectrum because there's so many confusing parts to this issue. From how to understand medical studies. Most people don't really want to know everything there is to know about how to read medical literature. They don't do that. They don't need to do that. They have to take some things sort of on faith. If a person who understands the medical literature reads it and makes a recommendation to you, that's how we've practiced medicine for a long time. Unfortunately, studies can be very difficult to interpret, and they can have many different interpretations. The subtleties on interpreting these studies make a huge difference on if something should be recommended or not recommended. So we're going to have to get into a little bit of the statistics, a little bit of the structure of a quality scientific study. We'll also get into some of the big players on both sides of the vaccine issue. You've got RFK Jr. and Aaron Siri and those guys on this side with their perspective. And then on the other side, you have the medical community and the vaccine doctors, Stanley Plotkin and Paul Offit and Peter Hotens, and there's lots of different players in the vaccine world that we have to understand where they're coming from. Why do they make the statements that they do? Why does it seem sometimes that there's opposing statements from both sides? One will say vaccines have never been tested for safety or efficacy. Another one will say, yes, they have been tested. Well, what's true? Have they been tested? How can they make this statement? Sometimes these statements are actually made under oath. How can they make these statements under oath? Can they technically not lie, but yet convey an untruth or a misleading truth? That's what we're going to get into. We're going to get into all of the motivations, the what they stand to gain by making these statements. And hopefully at the end of these videos, we'll all have a much better idea of who we can listen to, what we can believe, and a much better understanding about what vaccines are recommended, are vaccines safe, and you can make good recommendations then and good decisions for your family and friends. So if this sounds like your kind of thing, then stick with me, and video 2 will be coming shortly. I got to get over to the medical school library and look at some journals so that I have something to talk about. Thanks again for joining me. I'm Dr. Joe Kraft. Have a great day.